Hey team, we're going to talk about building towards success, okay, and the simulation's impact on success. And the lawyer time. I'm not your medical director. I'm not the state medical director. Nothing I say supersedes your medical director, your SOPs, your provider level or certification. Hey team, I want to talk about the pearls of simulation and growth for a minute, all right? And we're going to put it in the context, as I like to, of the good and the bad, right? So simulation is an opportunity to test new techniques, new equipment, new systems, as well as an opportunity to prove old skills. The study data on simulation use in EMS shows that simulation improves techniques and performance, as well as patient outcomes. Simulation should not be punitive, and we try very hard not to make it punitive. If you think it's being punitive, it's likely your own pathology. And should provide legitimate scenarios that provide opportunities to improve hard and soft techniques alike, right? That's what simulation is designed to do. While simulation is not the same as EMS practice, which we all fully admit, plastic mannequin is not the same as a patient, it does provide for practice of techniques as one would perform them in real life on real patients. The studies show that if your technique is not working under simulation, it is unlikely to work, or at least not work well under EMS practice conditions. If you are breaking teeth in sim, your intubation technique is suboptimal, period. If your hemorrhage control material is not neat, it's not on location, it's not applying pressure to the place it needs to be applied pressure to, and you're not obtaining the appropriate basic outcomes in simulation, then your technique will not work, or at least not work optimally in practice. This has been shown time and time again. If you're that person, right, who thinks, quote unquote, I will, or hey, I've done it in practice for many years and this is just sim, studies show you are not actually doing the technique correctly in practice either, and as such, you're causing harm in practice most likely, right? And I'll just stop being nice and say not most likely. If you're breaking teeth, unable to get through a basic sim, at least in the way that we perform them, you're definitely not working optimally in the field. You're definitely having patients that have less than optimal outcomes, period. Don't try to kid yourself, okay? So take this as an opportunity to be objective about your skills, about your room to improve, right? Because we all have room to improve. Everybody who's watched me come on and do some skills with them knows that I have room to improve too, and I fully admit it. That's why I love to train. As not doing so is likely hurting people who count on you during their worst day, right? We are there to be there for people in their worst day. And while we make jokes and we live a life where every day is someone else's worst day, it's just an average day for us, it doesn't take away from the fact that we are expected and we should morally, ethically be obligated for ourselves and our teammates to show up with the best technique we can so that people have the best day they can based on the scenario. So keep this in mind. The scenarios are designed in simulation to allow us to illuminate things we can improve on, period. And so you should never leave a sim saying, well, I've been doing it for 30 years and I always do a great job. If you didn't do a good job in the sim, then you have a lot of room to improve, period. And as a teammate, if your teammate is showing up to simulations and trainings and having that attitude, then it's something that we should take on board as a good teammate and with our soft skills and discuss with them, in a manner that's productive. As instructors, we should be productive. As leadership, we should be productive. As teammates, we should be productive in these soft skill sets of people who just do not want to train, do not want to see simulation for what it is, do not want to improve and fall back on it's my way or the highway and I've been doing this 30 years. Just because you've been doing something for a long time doesn't mean you've been doing it correctly or optimally. And we all have room to improve and grow. To include myself, I actually put myself first on that list. So I hope everybody can, put this tool in their toolbox, approach sim moving forward in the appropriate mindset, which is it's an opportunity to illuminate opportunities to improve. It's just an opportunity to improve. That's what it is. And definitely should get rid of however you need to, discussing with friends, reading outcomes, reading data that are in the references, whatever you have to do. You need to learn to jettison the showing up to sim and being reticent to learn, refusing to try new techniques, refusing to accept when your technique, does not do a good job at all. All right, everybody. I hope this helps. Tim out. As usual, we got to talk about the lawyers. So I am not your medical director. I'm not giving medical advice. We're just two professionals having a discussion. And it's important that we note that, given this will be open content. Hey everyone, here's a few references. I specifically put 2 references that are positive, meaning it illuminates how SIM helps us get better, grow, as an opportunity to practice our techniques in a safe place that doesn't hurt patients, and also the negative aspect of SIM. And the negative aspect of SIM is not simulation itself, but how SIM is conducted. And so basically we try to conduct SIM in a very positive way. That doesn't mean that we let people allow delusions to take over, meaning I did such a fabulous job when you broke all the teeth, tore the airway, and failed to get an airway in 4 minutes. No, that's not what it means. But what it means is that we're objective, calm, and positive, meaning, hey, definitely you cracked the teeth on this. Let's work at an opportunity to get better. Hey, you know, you didn't ventilate for 3 minutes. Hey, this is an opportunity to get better. Hey, you kept bagging the patient when their airway was full of vomit. That causes forced aspiration. Let's look at a few techniques to get better, right? So we have to show up with that positive attitude. And if you look at simulation data and reference, which I have here, there's no negative data points on the impact of SIM to reduce morbidity, mortality, or improve your ability to perform in real practice. What there is, though, is a way to do it correctly, right? So we will always focus on positive, but be objective, and that's what these references show. So take a look at the references if you want to with regards to the outcome of SIM on patient outcomes in your practice. And thank you very much. Remember, everything I say should be taken with a grain of salt. Prove it to yourself.